Welcome to Black Maternal Health Week. I am Sherita Bullock, the Executive Director of the Healthy Baby Network. It's so appropriate that during this week we'd be talking about the health of Black women and babies and thinking about all of the causes and contributors to the positive health and birth outcomes that we most desire when it comes to birthing Black parents. One of the things that we do acknowledge is that while positive outcomes, healthy babies, healthy moms, healthy dads are our goal, that's not currently where we are. When we look at our national statistics, we know that Black women have birth outcomes that are 3.5 to 4 times more adverse than their white counterparts. We know that the drivers are multifaceted and complicated. What does that mean? That means that each of the challenges that women experience are complicated by the systems, policies, practices, and structures that they birth in. And what do I mean by that? I mean that when we look at how our doctors and our hospital systems and all of our birth providers, as well as those non-medical supports that women receive, that we've got work to do. It requires us to take an honest look at the outcomes that we're experiencing, the effort that we put into the work that we're doing, and examining with our mothers at the table, birth providers at the table, clinical people sitting with us, as well as our community partners, to examine all of the contributors and work together to come up with innovative solutions. So when we talk about Black maternal mortality and morbidity, when you ask providers, what are the causes? Providers on one hand will say, we have women who often don't get into care early enough, don't know their health status, aren't confident about what their family history is, and then when there are adverse outcomes or deaths, those are the consequences of those health conditions. When we talk to families who've had near misses or losses, what we hear from those families is that we knew that something was wrong. We knew that this wasn't normal, but we couldn't find the language or say the thing that would get medical providers to act in ways that either prevented the near miss or were able to save the life of their loved one. So as we approach this, I think the most important thing to do is to not focus so much on the numbers, but for me to tell you some stories to help you understand the kinds of drivers and consequences that we're talking about, so that my hope is that you will come and partner with Healthy Baby Network as we sit together focused in on the experiences of parents to come up with the kinds of solutions that we really need, that will make the differences that we need. But remember, we're not just talking about data. We're talking about saving the lives of Black women and babies that the CDC estimates really 80% of those deaths are preventable. I don't think it's appropriate to really talk about Black maternal and infant mortality and morbidity without first acknowledging and taking a moment to center in on some of the moms that we've lost. I'm going to share some photos, and I'm also going to share the names of some women. We know that this list is not exhaustive of every woman who has died, but what we want to do is to begin to focus in on the stories and the experiences of these women and their families, so that as we begin to unwind and to unpeel all of the layers that are here and begin to talk about all of the challenges, we have an understanding of where they began. So join with me in a brief moment of silence to acknowledge these moms. Tatiana Otis French, who was 32 when she and her baby died in December of 2001 during childbirth. Dawn Fleming, who was 31 when she died on December 8th, 2014. Kira Johnson, Kira Johnson, who was 39 when she died on April 13, 2016. Shalon Irving, who was 30 when she died on January 28, 2017. Kalista Johnson, who was 32 when she died on June 7, 2017. Erica Garner, who some of you might remember her father, Eric Garner, who died. She died during her childbirth at the age of 27 on December 30th, 2017. Shimoni Gibson, who was 30 when she died on October 6, 2019. Yolanda Shapira Kadima, who was 35 when she died on July 27, 2020. Shanice Wallace, who was 30 when she died on October 22, 2020. Amber Rose Isaac, who was 26 when she died on April 21st, 2020. And very recently, and in the news a lot locally, Crystal Anderson, who died on March 20th, 2024. These women all left behind families and children who will forever grieve them, and who will forever, their children will forever get to know them through the eyes of others. We cannot talk about Black maternal or infant mortality absent centering in on the people who have passed, the lives that have been lost, and the families and friends who've been left to grieve them. This is a community issue. It's not a Black issue. It's not an issue for Black families to deal with alone. It's not an issue for birth workers who focus in on those families alone. This is an issue that is our community issue, our country's issue, and each of us have a responsibility and a job to do to stop preventable Black maternal and infant mortality. So let's get into what are the things that we can do. What are the responsibilities or the actions that we can begin to take right now that will begin to change and then ultimately end preventable Black maternal and infant mortality? So we can examine our systems first, understanding the way that we are preparing providers and future providers to work with families and to understand the intersections of culture, of community, and of relationship building that really begin to reveal and unwind how we move from treating people as numbers, as statistics, as patients that are just in a room that we don't connect with, to really engaging with them and beginning to understand their health status, their day-to-day practices, and the assets that they have in their lives as people and others that can support and help them. We can begin to look at how our medical systems and our community systems interact, and how we share information, resources, and knowledge to better serve families that are in need of medical and social additional supports. That might look like creative ways to address chronic illness while women are pregnant, and then teaching them lifelong ways to manage them so that we can mitigate and then eliminate that impact on future pregnancies. It can include looking at different ways to address nutrition and being sure that within our neighborhoods we have healthy foods that pregnant women have access to support the healthy growth and development of their children. It can mean ensuring that women, after they deliver, are attended to quickly to ensure that anything that might have started during birth or emerged immediately after birth is addressed in ways that often save lives. Being sure that there's ongoing support both provided within the family and within our community and with those other providers who are engaging families to ensure that women stay healthy, that any condition that arises after women have gone home from the hospital is also identified and attended to. Are you beginning to see a theme? We have to change the way that we're attending to pregnant women. We have to understand that being Black is not a risk factor. The risk factor are the way that our systems interact, treat, screen, and provide care to Black people and to Black women specifically during birth. We have to be sure that pregnant women understand the things that could go wrong during pregnancy and offer those kinds of supports. And so I'll end by just sharing with you some of the programs and some of the services that Healthy Baby Network offers to birthing families. We provide community health workers who work right where families are. We do home visits or we'll meet somewhere else in the community to provide prenatal education, birth support, and then postpartum care and education focused on having a healthy baby and ensuring that babies are meeting their developmental and growth milestones and parents know what those are. Doulas are non-medical support women who provide care during pregnancy, at birth, and in the postpartum phase to ensure that women get the kind of care that they would like, understand what the complications of pregnancy that might arise are, and to ensure that they have prenatal education and know what to expect during birth and those early days after delivery. We have a fatherhood program that provides services to men and fathers focused on the important contributions of fathers to pregnancy, beginning early in pregnancy and lasting throughout their child's entire life. We have outreach that goes out into the community to find parents who aren't connected to services and who then connects them. And we provide presentations like these to ensure that our community, our providers, medical and non-medical, our community partners, families, parents, and residents know about the services that are available that are there to help support them to healthy babies, healthy pregnancies, and healthy birth. So I want to thank you for the time that you spent with us today. I want to encourage you all to get involved. And if you are not immediately aware of what's going on at the Healthy Baby Network, visit us on our website to learn more about our programs and our events. And remember, the goal is to get active. So look for us. Our website is healthy-baby.net. I'm looking forward to seeing you, and I'm looking forward to your partnership and help. We can prevent and then eliminate preventable Black maternal and infant mortality, working together as one community to meet the needs of parents. Thank you.